It's affecting all of them. So the Big Beautiful Bill introduced a significant amount of reform that's really affecting states' Medicaid budgets. And in turn, that's affecting the decision makers to transact on a whole bunch of different levels. Not so much Medicare, but definitely on the Medicaid level, with states not knowing what's ahead as far as budget cuts from the government. So ultimately, right now, a lot of states are cutting budgets in Medicaid. And fortunately, there's been some grassroots effort to remove a lot of these. In my state, Texas, did a great job recently of some really draconian cuts to durable medical equipment schedule. They were able to mitigate those and reduce the cuts to a very minimal amount. So that's one way, but more notably, with this regulatory uncertainty and changes in reimbursement, it's really caused timelines of transactions to slow down, and we're seeing transactions take significantly longer and be exposed to a lot more regulatory and due diligence.
Significant impact, and it's uncertainty that's having impact because it flows to reimbursement issues, it flows to enforcement, some of the enforcement issues. And so when clients that I work with, and I tend to work with a lot of the nonprofit healthcare systems across the country, they're trying to plan out 18 to 36 months out on a transaction, and to not know where our reimbursement policy may sit is a significant impediment. So you're either taking a educated guess, which is a lot of what see our clients doing, obviously with analysis and thinking that through a little bit, but those kinds of policy shifts are very dynamic right now in the marketplace.
The ongoing economic uncertainty definitely has had an impact on deal movement, both in terms of the volume of deals, which is somewhat down, but also in terms of valuation. You're seeing buyers scrutinize valuations more carefully, less willing to take risks, potentially higher purchase prices just to get the deal done than they used to. And that's going to continue for the foreseeable future.
I think obviously there's so much concern when the announcements about Medicaid and Medicaid cuts came out, and how is that really going to impact? And I think that was just sort of general uncertainty. I think the reality is that healthcare is obviously a really critical space, and people are going to do deals because there's always going to be a need for it. And so even in spaces like post-acute, for example, where there could be considered higher enforcement, there's still a lot of interest in that space. And so I think from an overall healthcare perspective, companies are working closely with consultants and policy monitors to see whether or not they can read some tea leaves. So as we just saw with some of the fee schedules that came out, people got bumps, right? MA got bumps, other areas got bumps where people thought they were going to get declines. So I think there's definitely money to be had in this space, but they have to protect themselves accordingly so that the potential investments work out. I would say things from a slowdown perspective depends on the industry and whether or not there's current focus. This administration is a bit harder to read, I think, than maybe some others. And so I think if there's a pronouncement, people are trying to figure out, is it going to actually come true? And if it's going to come true, like in what time frame? But I see there being general interest across the board, even in spaces that are traditionally more risky from a fraud and abuse perspective or a government enforcement perspective, because of just the sheer demand for those services.
Yeah, I'd say the biggest uncertainty these days is probably at the state level. Again, we're seeing state antitrust attorneys general more and more active in antitrust enforcement. You're seeing more and more states pass mini HSR laws that require pre-merger notification. Some of those have longer timelines than the federal Hart-Scott-Rodino antitrust process, so you might have to build a longer timeline into your deal planning. The questions and issues that may come up in the state antitrust review can differ from what the federal antitrust enforcers typically look at, so you have to think about broader issues that the state AG may be interested in. So that type of uncertainty is probably one of the biggest areas of uncertainty that we face in antitrust enforcement in healthcare today.